The Laser Pages is proud to present an interview with Dallas dentist and periodontist Dr. Brock Lynn. Lynn Dental Care is a full-service dental and periodontal practice conveniently located just off the LBJ freeway. As a new patient, you will be warmly welcomed by a team of friendly and professional staff members while you relax in a beautifully decorated waiting and reception area. As a third-generation dentist, Dr. Lynn's experience and use of the latest laser technology ensures his patients receive the best possible dental and periodontal care. Good morning, my name is William Nayrod and I'm president and founder of thelaserpages.com, and I'm here this morning with Dr. Brock Lynn, a prominent laser dentist and periodontist here in the Dallas area. Good morning, Dr. Lynn.
Good morning, William. How are you?
Good. Nice to have you on our show today.
My pleasure, as always.
Now today what we're going to do is talk a little bit about laser dentistry. I know that you're quite an expert in this area, and would like you to tell us first a little bit about maybe your background, dentist.
Okay. Sure. Well, I grew up here in Dallas. I'm a third-generation dentist. I went to Austin College at Fine Regional University, got a biology degree. Graduated from Baylor College of Dentistry here in Dallas in 1980. And went into practice with my dad, the second generation. I'm the third. Practiced with him for 7 years and decided to go back to do periodontal training at Baylor, which I completed in 1989 and got a master's thesis in periodontics in 1990. So fast forward to this era, and more recently I've been trained in the periolays. I've been through their complete curriculum.
Fantastic. Now explain to me a little bit about what periolace actually is.
Okay, well, periolays is a patented FDA protocol procedure for treating adult periodontitis, better known as the common form of gum disease that we treat. And it uses a specific wavelength of a laser, the ND-YAG wavelength, to specifically target the bacteria that cause gum disease.
And how does that benefit your patients?
Well, most patients come to us because they've heard of laser periodontal therapy and they know they don't want to have the traditional form of gum surgery, which is cutting and sewing, done because it hurt them in the past. So periolays uses a technology that we don't have to do that anymore. And so the benefit to the patient is, the biggest benefit is they don't really have a lot of discomfort afterwards. Sometimes they report none, which is pretty amazing. The second benefit to the patient is the wavelength of the laser targets the bacteria that cause gum disease. So the energy of that laser actually reaches sites that maybe we couldn't get to with traditional therapies in the past, traditional deep cleanings and such. Now we still do the deep cleanings during the periolace procedure, but the laser energy actually augments. So those are the two biggest benefits. Another benefit is nowadays a lot of our patients have had cardiac stents placed, and now they're on an anticoagulant such as Plavix. Well, now we don't have to take them off that anticoagulant because we don't have the bleeding problems that we did in the past. So those are really the biggest benefits that I can come up with.
Fantastic. Now, are you using lasers in other aspects of your practice?
Yes. Yeah, we'll use lasers for routine crown and bridge procedures. In other words, having crowns done for gingival retraction, and we find that it's very efficient and the pain afterwards is very minimal to none. We'll use it for frenectomies, minor gum contouring and reshaping for aesthetic cases, cosmetic dentistry, and various other little small procedures such as soft tissue biopsies.
Fantastic.
Yeah.
Well, that's very interesting. Tell me a little bit about your father and your grandfather, who I guess were dentists as well.
Well, both of them are unique fellows. They both practiced over 50 years in dentistry here in Dallas, and they were both restorative dentists, and I was kind of the first guy to branch into the field of periodontics.
Fantastic.
But they were both very fine dentists.
Now, I understand you have more than one location here in the Dallas area?
I do. My first primary location is at LBJ in Preston, and my other location used to be my dad's office. It's in Preston Center in the University Park area in Dallas.
And so do you split your time between the offices? Do you spend your time primarily here in the Dallas office?
Primarily here at the LBJ office, but I'm one day a week at the Preston Center office.
That's great.
So we can accommodate patients at either location.
Fantastic.
Yeah.
Maybe you could give us a little bit of a tour of your facility here.
Sure, be glad to.
All right, fantastic. Thank you. So Dr. Lynn, here's the periolace equipment that we've been referencing. I was wondering if you could tell us a little bit about this piece of equipment.
Well, it's unique in the sense that it's been well researched. In fact, it's the only FDA approved protocol, and so that makes it unique. It is a digitally pulsed laser, and what that means is the technology and the physics and the electronics of it are advanced and heads above many of the other lasers that are out there that are not digitally pulsed. And of course, it has the unique wavelength that we talked about earlier. It's a portable machine, so it's very user-friendly. It has many settings in it. Because it's electronically, digitally pulsed, then it can be set for parameters for the patient's needs and for certain parameters using the protocol of periolase, or better known as LANAP, which stands for Laser Assisted New Attachment Procedure.
Now, I understand that the manufacturer of this equipment actually won't let you use it without some special training. Can you talk a little bit about that?
That's correct. If somebody wants to become a periolase provider, they have to ante up for 3 days, initially 3 days, full days of education before they will even ship you the laser, which one has to respect the company for that. And that's done up at the University of Colorado, Denver, under the guidance of Ray Yuckna, who did some of the original research, human histological research that's been published in peer-reviewed journals regarding periolase.
Well, while I understand that this technology allows for a lot of benefits for the patient, I was wondering if you might tell me a little bit about why you chose to go with periolase.
Well, I did my research, and I've been looking at this laser and laser technology in general for many, many years. And what finally really pulled the switch for me is that Dr. Yuckna gave a lecture at Baylor, which is an annual lecture for the periodontal community. And when he showed the benefits of the patient, there was less recession and the results, and the huge advantage of almost no pain afterwards, minimum discomfort for the patient. That's what really did it for me. So the paradigm shift is occurring even among the periodontal community, because in the beginning, periodontists were very skeptical of laser, myself included. However, that year, that was 2 years ago, not only was Dr. Yuckna given the headline lecture at the Arthur Merritt Lecture, which is a very prestigious lecture at Baylor, but also that same year at the American Academy of Periodontology meeting, one of the large general sessions was on the topic of laser. So laser, that's what did it for me.
Laser is becoming more and more prominent within the dental community.
Absolutely. And becoming more accepted as an alternative modality among periodontists, the specialists who treat gum disease.
Fantastic. Tell me a little bit about what a patient might expect as far as treatment time and what you do specifically to keep your patients comfortable during treatments.
So, yes, it's a good question. We kind of divide them out into quarters. We call them quadrants. So if a patient just needs one area, that's a quadrant, and that might take an hour. But most patients who really have gum disease, they've got it all throughout their mouth, so they might have all 4 quadrants involved. And so that can be, 4-hour procedure or a little more, sometimes 4.5. To keep patients comfortable and to keep it easy on both of us during that time, then we'll use sedation. And that can be oral sedation or intravenous conscious sedation. So in my training, we were certified in conscious sedation, better known as IV sedation. And that is what makes me unique in the sense that we can offer that to patients.
Well, it sounds like a nice benefit, and this sounds like a terrific piece of equipment. Thank you for showing it to us.
You're very welcome.
Well, Dr. Lynn, I certainly do appreciate the time you've spent with us today. I think your information you've shared has been both educational and very enlightening, and I certainly do appreciate your time. Before we leave, I understand that you have a special offer that you would like to convey to our viewers.
Absolutely. So, if a new patient calls our office and lets us know that they came to us via your website, then we will extend to them a complimentary examination, periodontal examination, and whatever x-rays they need.
Oh, that's fantastic. Now, what kind of dollar value would be attached to that normally?
That would be approaching $300, somewhere under $300. Couldn't tell you exactly because that's not my job, but that's a ballpark. So
okay, well, thank you so much for extending that offer to our viewers, and
sure.
I really appreciate the time you spent with us today.
You're very welcome, and my pleasure.
This is William Narod with the Laser Pages. Thank you very much for being a part of our show today. Have a good day.